So today I wanted to go through some knee taping techniques, particularly two which I find really useful for anterior knee pain and iliotibial band syndrome. So for this, I've started with the tape pre-cut. The first important thing to remember whenever you're taping is that you always have an anchor onto which you attach the tape. This is a standard sports tape, and I'm going to put my anchor on the inside of the knee here. So the purpose of this tape, which is called MCCONNELL tape, is to get that kneecap tracking just into the inside a little bit. So just coming in medially like this. There's two reasons for that. The first is to loosen out these fibers on the outside of the knee joint. And the second reason is to try and stimulate this muscle here, which is a really important stabilizer of the knee, to work properly. So we're starting there with our anchor. Then what I'm going to do is try and relax this knee as much as possible. So I'm just going to pop a pillow underneath. Take my next strip of pre-cut tape, and I'm going to put that on the outside of the kneecap, and I'm going to use that finger to pull the kneecap across and the other hand to pull the tape down. Just show you that from the top. Tape, pull across on the kneecap, and the other hand pulls the tape down onto the inside of the knee. And then we'll put a third strip. Tape on the top, pull the kneecap across to the middle, and tape on the bottom. We always close in our tape on either side, so we'll cover the anchor. So that's the MCCONNELL taping. Now the second type of tape I'm going to show you aims to put a little bit of pressure on the iliotibial band just about here, and also to glide the kneecap down slightly. So I found this really useful before when running marathons and things like that, just because it sticks a bit longer. So for the anchor for this one, I'm going to use some hypoallergenic under wrap, and basically I'm using that just because it has a little bit more give, and I'm going to put that right around here. This is useful as well if you get very sensitive skin. So we can see the kneecap there. But I'm not going to go right the way around with this because I don't want to cut off circulation. But I'm going to just put one layer on the top here. And then with the next strip, I'm going to come and I'm going to twist the tape on itself. Now you'll probably need to use the scissors to tear. And I can do as many of those as I like. So this time I'm going to twist the tape a little bit later. And this one I'm going to try and twist just on top of the kneecap. So playing around with it, that's about 3 layers. So you can just see what it looks like here. What we do is just close it in on the top. So try those two. We can do something a little bit more specific with you after an assessment in the clinic. Give us a call.